New data from the CDC surprising many across the country today. It shows the Delta variant of COVID-19 can spread as quickly as the chickenpox and could be more severe than we first thought. Good evening, I'm Kay Quinn.
And I'm Michelle Lee. 5 on your side, Sydney Stallworth had a chance to bring this data to one of the country's top leaders in the vaccine rollout and get his take. Sydney?
Kay, Michelle, today I talked with White House COVID-19 vaccine coordinator, Dr. Bakara Shukar, to talk about these findings. The CDC did publicly release new data today, but there was also an internal presentation that the Washington Post got a hold of and released. The report shows a chart that compares the Delta variant to other contagious diseases. Researchers found that it could be just as contagious as the chickenpox and is more contagious than smallpox, polio, and the common cold. The CDC also found vaccinated and unvaccinated people who contract the virus carry similar amounts of the virus, meaning a vaccinated person could transmit it just as easily as an unvaccinated person. Reports say this data is what led the CDC to change its mask guidance earlier this week. Dr. Shukar says the vaccine is still offering protection from the Delta variant, and if you haven't gotten your shot, now's the time.
The fact that now we have a variant that's twice as contagious, much more contagious, is another call, a wake-up call. It's a call to action for these folks to get vaccinated, and that's really the message today.
There is some good news in the CDC data. The agency says the vaccine is still highly effective at preventing people from being hospitalized or getting really sick. That's why officials say it's so crucial that more people get vaccinated. Tonight at 6, we hear how the White House is hoping incentives will get vaccination rates up here in Missouri and across the country. Sydney Stallworth, 5 on your side.
All right, thanks so much, Sydney. St. Louis area COVID-19 hospitalizations are up 30% in the past 8 days. We are nearing the highest number of COVID hospitalizations we've seen since February. 92% of hospital beds are filled, and the number of patients in the ICU has doubled in less than a month. The St. Louis Pandemic Task Force says these numbers are only expected to get higher in the next few months.